Wow. This is going to be a great show about, well, I mean, I hate that we always have to talk about COVID, but this is a different approach.
This is an approach that we all can learn from.
Absolutely. And we need to. It just because it's gone on for 9 months doesn't mean there isn't new stuff and there isn't old stuff that they have learned from.
That's right. So this is going to be a special edition.
Yes.
ZoeTV COVID mask as we head to the fall. Our numbers are going up a little bit, and as Glenn Croft always is, we're thinking outside the box and we're trying to be proactive, and we're bringing on a guest that's hard to get.
Oh,
she just left and said she's off to the Today Show next.
Yeah.
I mean,
well,
I thought President Trump was a big deal. Buffy,
this is
the COVID
Buffy,
Slayer.
The
this is a real deal.
COVID Slayer, yes.
Dr.
Yes.
Buffy.
I cannot wait to ask her about why the numbers are going up, what we can do, and what have we done right.
And I just want to hear common sense approaches to how we navigate and help each other out.
I agree, because we are in this together. It is one thing that the entire world has in common.
Very cool. So, buckle up, enjoy the ride, learn about masks, learn about COVID-friendly hygiene.
Learn
Gonna be
about
exciting.
slaying.
Slaying.
Well, here we are, and I am so excited to hear what Buffy the COVID Slayer has to tell us.
This is like a celebrity in our midst.
It is. And
in this era of COVID.
Right, and we've already pummeled her with a million questions. So we are so excited that you're here and sharing really important information. I mean, it's a serious topic, it's a serious time, and we can't take this too lightly. So tell us what you know, Doctor.
Tell us everything.
Well, I'm super excited to be here and to be able to provide some information for your residents. You know, this is the most vulnerable population. And this virus, we know, has a significant mortality, morbidity for elderlies in your community. So we want to make sure that they're protected.
Sure.
And the work that I do, I'm actually going across the country into different skilled nursing facilities, nursing homes, assisted living, and independent living facilities all over the country, making sure that they have safe practices implemented to help keep them protected.
Wow, that's a big
Fabulous.
job.
Yes.
That is a big job.
Well, we're lucky to have you. Thank you for stopping here on your travels.
My pleasure.
So before we get into all of that, tell us a little bit about, like, before COVID hit and before February and March came and the world turned upside down. What were you doing? What was your role in this world?
Well, so I actually started my own business, IPC Well, about 3 years ago because I saw a huge need in the long-term care arena in the industry for infection control. I was working before that on a national pilot study with skilled nursing facilities across the country, reporting C. difficile infection into the Centers for Disease Control and Prevention, the CDC. And I just saw these huge gaps within the industry. And so I was knocking at CMS door and knocking at CDC door, and I said, we've got to do more. And well, needless to say, I said, I'm going to do something about it. So I stepped out.
Good for you.
I created my own business because I really wanted to be able to make a change and make a difference. And to be honest, I wasn't heard very often. I would you know, really reach out and let people know, hey, we've got a problem. We've got a problem in this industry, and I wasn't really heard much until COVID, until now. So I'm not surprised at what we've been seeing, unfortunately, in this healthcare setting, because before COVID, we had challenges.
Sure.
And I'm hoping, it's my hope that moving forward, the challenges we can continue to work on infection prevention and control so that if another pandemic occurs, we're ready. But even outside of that, long-term care has a lot of infections anyway. It's a vulnerable population. Right? We've got flu, we've got multi-drug resistant organisms like MRSA, we've got C. difficile, we've got pneumonia, skin and soft tissue infections, UTIs. I mean, the list goes on and on. So So there's a lot of education and training that needs to occur to protect this population.
Right.
And that's my mission and that's my goal, is to provide protection so that our loved ones don't have infections.
Well, on
Awesome.
all of our episodes that we've had post-COVID, everybody gets to a talking point of best practices and
Yeah.
how we've all changed. And no matter if it's chiropractic care or massage or whatever the industry is, everybody's adjusted.
Mm-hmm.
And I think hearing from you on how you were in the, way back in the last couple of years, seeing this evolution coming and creating your own best practices, going in, trying to tell the world, like, you got to listen to me, like,
Right.
this is coming. I think it's great perspective.
Yeah, and so I think that what I first want to acknowledge to the people watching is that we all are kind of in this pandemic fatigue. We've been in it for a minute and we're tired.
Yeah.
But what I want to encourage everybody is to continue to do those small practices every day, not only to protect themselves, but the community around them. And that's really, really critical right now.
I think that's a great point, because we all are in this for so long. We're all just kind of like, enough already.
Right. You get tired of wearing the mask. You get tired of being away from friends, doing the social distance, but it matters.
It does.
Right? They have said, I mean, pretty much across the board, that's what's helping.
Right.
When we have the downturn, it's people are doing it right.
Exactly.
So should we just jump
Yeah.
right into what you do and how you can show us what's best?
So I'm going to do a couple demonstrations, or one demonstration, I should say. But the first thing that I want to say is the critical importance of wearing your mask. We all have our masks, and it's not always fun to wear a mask, right? So I just have a typical surgical mask, but you can have a cloth mask. It's really important because the main source of this transmission of this virus is through the droplets that come when we talk, when we sneeze, when we laugh, and when we're interacting together. Those droplets have been demonstrated to show that it is the main driver of this pandemic. So if we put on a mask, then my droplets are only hitting inside of my mouth. They're not going to reach you,
Right.
because they're going to be stopped right here where my nose and mouth are. If I take my mask off, then the potential is, if I sneeze or cough, then those droplets could spread. So it's really important that whenever you're around somebody, first to try to maintain some distancing, social distancing, but then also to wear that face mask and to keep yourself protected as well as those that are around you. And I know that it can be challenging, but it's a really, really important practice that we use this simple little tool to keep our communities safe.
Well, and even just talking, right? I mean, you don't have to sneeze or
Right.
laugh to have,
Projecting out,
you've
yeah.
talked to people before where you've seen that, right?
Right.
And it's kind of like, oh, it really happens.
Yeah.
So,
Yeah, so I just want to demonstrate, because the other thing is we all know about hand sanitizer. I carry my own little hand sanitizer in my pocket wherever I go. Anytime that maybe you're, coming into just hanging out with people, or, before you're, maybe touching a surface, especially in this healthcare setting, just use the hand sanitizer often. There are some hand sanitizers that have been shown on the FDA that they're not safe, but you can look that up on the website. You can just Google FDA hand sanitizer, and you can look to see if there are some that are toxic and not safe for use. But typically the ones that we see sold in the regular store are fine.
Okay.
So not something to be like overly worried about.
okay.
The other common thing that I see, if we're going to wear a mask, let's wear our mask appropriately. So wearing it like this is not appropriate. Wearing it like this is not appropriate. You might as well not have one at all if you're going to wear it below your chin or your nose. So.
Well, what about, I've seen a lot of people wear
below.
it just right above, like that.
I see it, below the nose. I
Right.
see this often.
Right.
Again, you've got droplets that can come out of your nose. Not as prevalent as the mouth, but they still can happen. Even like you and I, if I'm talking to you without a mask, the mucous membranes, including our eyes, we could even have droplets into our eyes. So it's really to protect, again, yourself as well as other people. The other common thing I see, and I'm just going to do a little fun demonstration. I'm going to put some gloves on. So like when we're wearing our mask, we want to make sure we're wearing it appropriately. And sometimes they become really uncomfortable, or we're just not used to talking all the time with the mask. They can slip down. So we want to practice, if we have to touch our mask, the best way to touch it first is through the strings behind the ears if you need to adjust it. That's the best way. It doesn't always work. So then we have to maybe touch the top of it, okay? So I'm just going to show you what happens. So we can't see the coronavirus. We can't see influenza. We can't see multi-drug resistant organisms, or we can't see these germs. And so how do we, it's really important that we practice hand hygiene. So let's just say I've got this virus on my hands. Mm-hmm. I've touched a surface, or, I may have been exposed to it. And then I'm like, oh, my mask, I'm annoyed. I want to pull it down, bothering me, So
your glasses fog up.
My glasses are fogged up. I want to talk to you with my mask down. So we can't see these germs if we're constantly touching our face. Well, we've got germs on our mask. We always want to consider the outside of our mask contaminated. Because if I'm talking to you and you're not wearing a mask and I am, your droplets can be hitting the outside of my mask, right? And so this is dirty. So now if I'm touching it, then I'm possibly contaminating my own hands. So the best thing to do is to try to avoid touching the face mask. I'm going to remove my gloves. And so if I need to touch my mask, that's fine. You can adjust your mask, but then use hand sanitizer so that you're actually washing your hands after you've touched the mask. And when you take it off, kind of lean into it and pull it off so that I have, pull it away from your face and then use hand sanitizer then to kind of clean your hands.
That's great to have technique, because I think all of us were thrown into the idea of wearing a mask, but never were properly educated on how to do it. It's like, well, wear your mask. And the idea, because I see it in our environment we have in the fitness center and around, of I can't breathe in it. It's hot. If no one's around me, I'm going to pull it down just so I can breathe because I'm working out.
But you're touching,
But they're constantly, and I'm the same way.
All of us,
it's just very handsy, and I see it all day of handsy. My nose itches, then I'm going back in, and there's no thought because no one's ever been taught the importance of it.
Well, this is not a normal world right now. We don't normally wear face masks. We don't normally have to keep our nose and mouth covered. So it's a situation we're in right now, and it's temporary. This isn't going to last forever. We're on the breakthrough of getting vaccinations, and hopefully that will help to decrease the spread more if we have people that are vaccinated. And so, there are solutions. We're getting better treatments, so I want people to have hope that this isn't going to last forever. So right now, today, let's do what we can to protect ourselves and to protect those around us. I mean, especially in this healthcare setting, it's critical because there's more underlying health conditions, and just the age of the people that live in this environment are the most vulnerable. This is really important.
Well, I have a couple questions. So on the masks, how safe are the cloth ones? Because I know I prefer that. They're softer. And do they need to, I wash mine every day, but is that enough? Or do you need to be changing masks throughout the day?
No, it's fine. Okay. It's fine to wash your cloth mask. It's really up to preference. The main thing is just to have that nose and mouth covered. That's really important to help stop those droplets from leaving and going and traveling into the air, basically. So that's really important.
That's a good question, because I know we've had so many.
Because I don't actually like the cloth mask. I think that it's preference, really.
Right.
Well, and I know you had said when we were just talking that they have now, that at one time they said, well, you wearing a mask really only protects you, right? Or protects you, but now you know it goes both ways.
Well, so it does protect the people around you because it stops your droplets from going out. And then it also, there is a level of protection for yourself as well. It's not a huge level of protection, but it is a level of protection. But the best protection is if both people who are interacting have a face mask on.
Okay.
Yeah.
And gloves. I know you put those on for the demonstration, but
do not wear gloves.
Okay, I had heard that too, because then you don't wash your hands.
Exactly. It's actually, and you'll not find this anywhere on any public health website. There is no indication to wear gloves. If anything, you are potentially contaminating the environment everywhere you go because you're not doing hand hygiene. You're not washing your hands. So it kind of freaks me out whenever if I'm going to the grocery store, or if I'm going somewhere and I see people wearing gloves, because I know that whatever they've touched is dirty. They're not using any hand sanitizer.
That leads me to a question I have to ask. If you are living your normal life and you're out and about in restaurants, do you approach people and try to help with this knowledge? It'd be so hard to be out and seeing it wrong. I'd be like...
Honestly, I'll just have to, this is kind of funny, but I travel a lot, so I'm on the airplane, and most people do a really good job on the airplanes. They're required to wear a face mask that cover your nose and mouth. Unfortunately, maybe a few people, they decide to keep it below their nose, their mask, and they always happen to sit next to me. So I just let them know I work in outbreaks. I go into nursing homes that are COVID positive, and maybe they want to cover their nose, you know.
Funny how that works. Oh, all of a sudden they know how to wear it.
Because, and this can help segue to another topic, is we don't know. This virus is very much spread when you don't even know, you don't even have symptoms. So it's known as asymptomatic. Right. And that is also very similar to the flu. You can actually spread the flu virus a couple days before you actually ever feel symptoms. So this is very similar to COVID, you know, but with COVID you can be asymptomatic up to 14 days.
Right.
So that's a long time.
And still spread it.
Right, so we don't know. So that's why it's really important, because we're all sitting next to each other, but we're socially distanced, but we don't know. And so we have to continue practicing those measures, again, to protect ourselves and others.
Okay, what about the shields? I've seen some people wear the shields without a mask. Is that effective?
The purpose of a face shield is really meant for your healthcare providers, and they are protective for your eyes. It's eye protection. You'll see sometimes a face shield or eye goggles. Glasses aren't effective eye protection because of the openings.
Sure. Right.
But the eye protection is really to protect the mucous membranes in your eye. So it's not a substitute for the face mask.
Okay.
The droplets can still come out of the, escape the shield. So it really needs to be, you need to wear your mask. If you want to protect your eyes, then that's fine. You can wear a face shield or eye goggles. There's nothing wrong with it. But it's really designed more for your healthcare worker that's working with these sick patients and protecting their eyes, that real up close.
That is, because I think some people thought, well, wow, if a mask is good, this shield must be better. But without the mask...
You need the mask.
Yeah.
You need the mask.
Okay.
Yeah, and to be honest, the mask is more comfortable than the face shield. So, I mean, it is,
I think just in our demographic here, in the way that so many of our residents, their underlying conditions of asthma, some of the, just a hard time breathing in general, whether it be allergies or, whatever they have underlying, they're reluctant to wear the mask because they have a hard time breathing.
Right.
And that's the biggest conversation I have with a lot of our residents is, I can't breathe with this on. I just can't do it.
Right.
And I think it's important to hear these conversations because, like you said, it is the time, it's the season we're in right now. It's not forever.
It's not forever. It's for now.
Well, and one thing I can speak to that is if you have a mask that you can't breathe, try another mask.
Right.
And I have a harder time breathing with the cloth mask. So I use the 3-ply, and then maybe somebody that would use a 3-ply would have so there's a multitude of masks now. There's not a shortage of face masks. So find one that works for you, and try that. Don't just blanket all of them. And then if you truly do have a condition that you cannot keep a mask on, then what's really important is to maintain that social distancing as much as possible.
Yeah.
I mean, that's going to provide a level of protection.
You got to be doing one.
It's look, we have to be sensitive. We're human beings. We all have different circumstances that impact us in different ways, and especially in this healthcare population, So I'm very sensitive to that, and I don't look at everything as just cut and dry. If you truly have a reason why you can't, well, then let's modify. Maybe you visit outside where there's good airflow, and maybe this virus loves to spread indoors. So maybe some of the visits can be done outside and socially distanced. So there's some ways that we can do things if you truly have a medical condition that doesn't tolerate it.
Yeah.
Okay, so what about the K95 masks? Are they better?
The KN95?
KN95, yes.
So better than what? The
Better
surgical
than
or the
cloth or...
They do provide a higher level of protection.
Okay.
And originally, we had the KN95 masks in healthcare because that's all we could get. So we're working with patients that have actual active COVID, and sometimes that's all we had is, and an N95 mask, which is really the best protection for the individual, is because it has a complete seal around the entire nose and mouth. Very difficult to wear for a long period of time, I'll tell you.
Okay.
So it's not something that, an N95 mask is appropriate for a healthcare worker, who's working directly with somebody that has COVID. A KN95 mask, I know they're readily available. If you can tolerate it, fine, but it's not necessary. I mean, that surgical mask or a cloth mask is sufficient when you're around other people.
Now, what about these masks I've seen? Because I actually got one right at the beginning that was a KN or an N95, but it had a circulation little
filter,
filter.
An exhalation filter.
What do you think of that?
Yep. So what's really important of those, they're exhalation valves, and they're really good for the person wearing them because they help help you breathe better. But they are not good for the environment, so they can still disperse droplets within the environment.
Oh.
You see that go around the person.
Yeah.
I believe that California actually outlawed them.
Did they?
I'm not entirely sure, but I know that they had a pretty much, you were not able to wear those in public. And if you do have one and you need to wear it, wear a surgical mask over it.
Oh, okay.
So you can...
Okay.
Does it still help with the breathing?
So here's the thing, you might as well just wear a surgical mask.
Okay.
I was gonna say, okay.
Yeah,
Okay.
so if you see one of those, it's providing the person with protection, but not necessarily the community. And this virus, we want to keep our community safe and protected. And it really is thinking about each and every one of, each person. Yep. And so, those masks are not really appropriate.
Okay.
Okay, so we're entering the holiday season.
Yeah.
What tips do you have for families that are adamant they have to get together? We're not going to not see each other.
Right.
What are some best practices you would have for a Thanksgiving meal? Is it outside? What's your suggestion?
Yeah. So definitely if you live in a climate like here in Arizona and the weather is good and we can tolerate, absolutely outside is the best case scenario. Like I said, this virus loves to spread indoors. So if you can eat outside, that's preferred. If you are even eating inside, maybe having some windows open just to have some ventilation. The CDC recommends that if people are not within your immediate household, that are living with you, then to avoid actually getting together. And that's really hard for me to say. I have 5 kids. I have a grandson. They, live in different areas. But I'm, if you can go outside, that's the best situation, which is what we're doing. I'm actually going into a quarantine before, just for my own self. But, we really want to look at who's gathering. Mm-hmm. And if we have our elderly or those with that are immunocompromised or underlying health conditions, guys, Thanksgiving's my favorite holiday, but we need to make adjustments this year. We really do. It's for the best of our protection,
And our community, because really we have to help others.
Yeah, I know it's a challenge, but the other thing is just, I heard Dr. Fauci is doing Zoom with his kids, so maybe there's just some creative ways that we can meet together for these holidays that'll just be a little different. This year will be one to remember for sure.
Yes.
So I know you mentioned outside is so great because you're obviously getting sunlight and the virus likes to be indoors. What are your thoughts on masks when being outside, if you're golfing or you're hiking or you're doing things that you're socially distanced? Are those coming off? Are you comfortable at that point if mask off when you're walking
nobody's around? Yeah. Okay.
Okay, good.
I really do. It's really meant for that one-to-one interaction. And even outside, the spread is not as prevalent even with people out not wearing masks than it is inside. So, yeah, if you're not around anybody, your droplets are not going to suddenly suspend in the air and then hit somebody else down the road.
I feel like we went through so many stages of an evolution of everybody's thoughts because nobody really knew, right? So everybody is, today it's one day, and 2 days it was something different. But where are we now with the droplets and it living on surfaces? And where are we at nowadays with that thought?
Yeah, so the main transmission, what we do know today is the main transmission of this virus is through the droplets, really through human-to-human interaction. There is research that indicate that it's airborne. It has been identified airborne in fitness centers and restaurants, which means that the particles are suspended in the air longer. But that's still not the main driver of this pandemic. So it's mostly our interaction, close together and not having a mask and talking and whatnot. On the surfaces, you definitely can say if I'm coughing on a surface and then somebody comes up and touches their mouth or nose, they definitely can potentially infect themselves, but the risk is low.
Okay.
So, I think I agree with you in the beginning. We were, disinfecting all of our milk bottles and everything that came in because we didn't know. And it's really not a main source of transmission. So I think we can be cautious. One thing I love is just if you can carry some hand sanitizer with you, and use this frequently, because the only way you're going to become infected from a surface is if you touch the surface and then touch your mouth or nose. It's not going to magically jump on your arm or it's by touching your mouth. It's by putting the particles in your mouth or your nose, or you're rubbing in your eyes. So, for example, when I pump gas, I have my little hand sanitizer in my pocket, and then I do hand hygiene.
Right.
If I come out of a store, I have touched things in the store, I use hand sanitizer.
It's a good habit.
I try to be conscious of not touching my mask. I try to be conscious of not touching my face.
Okay.
That's good. Okay, so I got a question I keep thinking about. What do you think's going to happen to the flu this year? Like the general flu and our number, are they going to drop because everybody's so aware of this right now?
Well, I don't think it's just aware. The way that the flu is transmitted is the same way COVID's transmitted, which is through our droplets.
Right.
And we're all wearing masks, hopefully.
Yes, we are.
And socially distancing. So I believe that as a result of those habits that we've already implemented, hopefully we'll see the rates of flu decline, as well as I believe people are more apt to go and get a flu vaccination. So if they haven't, this is a great time to do it. I got mine, go get your flu vaccination, protect yourself, because you can get the flu and COVID. You can get both. And this could create a big health problem for you. So you want to really do what you can look, we have a vaccination for influenza. Let's go get it.
Yes.
Even if, I know some people say it doesn't work or I get sick when I take it, even if the vaccinations don't always completely match up with the type of strain we have, it has been shown to decrease symptoms significantly if you do get the flu.
Right.
So it is a good preventive measure. But I do believe that we'll see a decreased amount in the flu this year.
I guess that's the positive side.
I have one more question.
Okay.
So why do you think the numbers are starting to go up? Because we were so excited that people were really embracing the masks. The numbers seemed to go down, and now they're going up. And I think people are wearing their masks for the most part.
So I was working in Detroit with Doctors Without Borders in the month of June. And because Arizona didn't really have a whole lot of COVID.
Right.
So I went to help a hard-hit area in the nursing homes. And about mid-June, I start seeing the COVID rates go higher and higher and higher. And it was like, of course, we're 100, 110, 115 degrees. People are hot. They're going indoors.
Oh,
This virus loves the indoors. So you saw Florida, Texas, Arizona, those states really soared in the summer.
I have not heard anybody say that, but
Now it's getting cold. People are going indoors. And this is where people congregate. And, you know, even in your family, you could have, you know, different jobs at different places. But when you come home together, you're not wearing masks.
Right.
So it can very much spread that way.
Oh.
So it's really where we go as, you know, our weather.
Yes.
So even in the summer, in my home, I would keep the window open to allow some ventilation to occur in the home. Even if it was hot, my kids were like, "Mom, it's 110." I'm like, "I know, but we got to keep the air moving." So if we can keep some air, or just as much as being outside, I know that's difficult in cold places.
Sure.
So,
But here we should be embracing that.
Yeah.
we really
So-
should. And then another reason we see our rates, it makes sense. Our schools have opened, our universities have opened, a lot of our businesses, our gyms, our restaurant, like we've opened these areas that we're not always wearing masks.
Right.
So the more we have people together indoors, the greater the spread of the virus.
Okay.
It's just is what it is. And
That makes sense.
It does.
Wow,
Yeah.
thank you. This has been
Very, I mean, we could just keep going. This is amazing.
Yeah, this has been really
Good.
valuable. Thank you. And I
Yeah.
think your takeaways are hand sanitizers, wash your hands, and
Well,
wear your mask.
I think when you show an example of paint and you say, wow, because I know we're all touchy-feely with our own masks, and you see that come to life on that mask.
Yep. Thank you.
yeah, I think just having that I mean, it's the basic principles that public health has been preaching, right? Like hand sanitize, do good hand hygiene, wear the face mask, socially distance, can go a long, long ways. And it's not forever, guys.
Yeah,
Oh.
I think that's a great point.
This is, I mean, we're in it, and it's not going to be over anytime really soon, but it's not going to last forever.
This too
So
shall pass,
It will.
right?
It
Good.
absolutely will.
Okay.
Well,
Yep.
thank you.
Thank
Very great.
you.
Yep.
Awesome.
What a show.
I mean, Kate,
What?
every episode is great. This
Is greater?
great. I mean,
It's
it's
great.
important. It is what it is. We're in this
Man.
moment, so we might as well do our best. So
I agree. And
bring on somebody to teach us to do better.
I know we both had a lot of questions.
I had
and
a ton that we didn't even.
I was
going
going to say we could go on, but I think some of the takeaways
Yeah.
that were so valuable and was the hand sanitizer. I have to say, carrying it with you, because by the time I find it, it's buried in my purse. I
Right.
never think to just have it in a pocket
I think it's great.
because you get out of the habit.
Well, you do, and I think her analogy of pumping gas rings true with me because I'm always looking for the napkin or something
Yes.
that's. I'm
Yes.
trying to hold the thing.
Right.
It's just like just do it and then clean your
And
hands.
clean
Like,
your hands.
It's simple.
Right.
Simple. And the masks, obviously, a lot of the show was about masks, but I think the demonstration of the face and the mask obviously rings true. But just the wearing of the mask up above the nose, not here. I think so
Yes.
much that you and I see, that you and I do.
Right.
I think hearing it firsthand from a doctor whose entire objective is to help.
Right, and her whole life is studying viruses and studying, you know, I mean, we've known this about the flu.
Right.
And in our Providence place, flu season, you can't go in without wearing a mask or having a flu shot.
That's
so I think this stuff is going to now go across the board, and it should. Wear
I think your
a mask.
takeaways: mask,
Mask.
hand sanitizer. We live
Washing
in
your
Arizona,
hands.
sunshine.
Oh,
Be
being
outside.
yes.
If you can do it and you're meeting with some friends in your courts and we have plenty of seating outside, do it outside.
Right.
Come down to Peacekeeper's Garden in the Performance Center, sit on the patio, space out, enjoy outside of the bistro. All the lights are up around
Oh,
campus right
yes.
now. It's going to be a beautiful time. Enjoy the sunlight, get outside, wash your hands, wear your mask. Those are my takeaways.
I agree. And the shield, I thought that was interesting because the shield is really not beneficial
shield.
unless you have a mask.
And then at what point does...
And she really said
wear the
they
mask.
really are only for the health workers that are working with people with COVID.
Yeah,
so
and the eyes.
she cleared up a lot of things, and she made it simple. She wasn't a doomsday, like,
I agree.
this is going to be. You know, I really did appreciate that she said, it is not going to last
No,
forever.
this is a season we're in.
Will be gone.
That's
So
exactly right.
we will have other challenges, but I think this one, it's our responsibility.
I
Wear a
agree.
mask.
And as we're heading into fall, mask up. It feels good. It's cold
It
out.
feels
Keep it over your
good.
nose.
I know. Now
It's
I like
now it's
my
warm.
mask.
It's not bad. All right, Kay, we're out of here. Great episode.
Yes. Thanks for watching.